Hyperbilirubinemia is a common condition in neonates which have yellow skin and eye yellow coloration. This condition is due to hyperbilirubin level in neonates. You will speak with level. Yellow skin coloration in newborn is due to high level of bilirubin. The normal level of bilirubin at birth is about 3 mg per deciliter. It's increased up to 6 mg per deciliter on the first day, and it can increase on second and third day up to 12 mg per deciliter. The level of bilirubin is slowly decreasing up to 7 day up to 5 mg per deciliter. If the level of bilirubin is higher than this range, we can call them hyperbilirubinemia. When we should be serious about the level of bilirubin? When the level of bilirubin is increasing up to 15 mg per deciliter in premature or 20 mg per deciliter in mature, or increasing 5 mg per deciliter per day, it's a serious condition. We should observe the baby and we should take action to detect the problem and treat it. In general, we have two types of bilirubin: direct bilirubin or conjugated bilirubin, indirect bilirubin or unconjugated bilirubin. Direct bilirubin is water soluble and indirect bilirubin is fat soluble. Direct bilirubin is blocked by brain barrier. It can't enter to the brain or damage our brain. So it's safe for baby. But indirect bilirubin is fat soluble and it is dangerous for our brain and can damage brain and causes kernicterus. Kernicterus is a serious condition in which damage of brain is started. The initial signs of kernicterus is lethargy, forbidding, and loss of motor reflex. Bilirubin metabolism. Bilirubin is a yellow pigment that is derived from degradation of heme. Heme is a component of RBC. Firstly, the bilirubin is in unconjugated or indirect form. It goes through blood to the liver, and in the liver is conjugated by a special enzyme which is called UDP glucuronide transferase. Then that's converted to conjugated form which is called bilirubin monoglucuronide and bilirubin diglucuronide. These forms are water soluble and they excreted through bile to the lumen of intestine. These forms go through stool and excreted from our body. Sometimes a special enzyme in intestine that's called tissue glucuronidase convert these two, bilirubin monoglucuronide and bilirubin diglucuronide, which are direct bilirubin. They are converted to indirect bilirubin, and these indirect bilirubin are fat soluble and reabsorbed to our body, and they recirculate it as unconjugated bilirubin. So, in general, we can say that unconjugated hyperbilirubinemia may be caused or increased by first, increasing the load of bilirubin. For example, increased enterohepatic circulation, hemolysis, polycythemia, short or BC span, and internal hemorrhage. Second, reduction of bilirubin uptake by liver cell, for example, in premature neonates and genetic problems. Third, blockage of transferase enzyme by drugs. Fourth, reduces activity of transferase enzyme. For example, thyroid deficiency, genetic problems, and infection. 5. Displacement of bilirubin from albumin. Bilirubin binds to albumin in blood, so those drugs that displace this bilirubin or decreases albumin, they causes an elevation and increasing of serum bilirubin. So this condition causes to increase indirect bilirubin in our body. Delay in meconium passage, which have 1 mg per deciliter bilirubin, may contribute to jaundice. This bilirubin is converted by tissue glucuronidase to unconjugated form and then reabsorbed and contribute in jaundice. 1, 2, 3, 4,